Now, today is World Stroke Day, and on a day like this, attention is being drawn to what causes stroke and how it can be managed and how it can be prevented and things around that. So today we'll be learning some of these things because a lot of people have a notion that you get to a certain age and then certainly stroke is one of those things to set in, but certainly it can be preventable. It can be prevented, and some of these things that we need to know, maybe habits and so on. So we have in the studio to help us make sense of this, Professor Yomi Ogun. He is a consultant physician and neurologist at the Lagos State University College of Medicine. Prof, it's nice to see you this morning.
Yeah, good morning.
You're welcome.
Yeah,
great.
Nice having you.
Exactly.
Having me as
exactly.
Well.
Nice to have all of us on the show.
Yeah.
Great. Now,
so much.
A lot of people, in fact, most people, when you hear the word stroke, it's quite scary sometimes, where it feels like the moment it gets to that level, is non-reversible. It's a state, that one is going to be for the rest of the person's life. But basically, talk to us. What is stroke in the first place?
Yeah, thank you very much, Mike. Good day, everyone. Well, to start with the definition of stroke, I will say it the local way. In Igbo language, it is called Mbamo.
Mbamo.
Yeah, or Oria.
Okay.
Mbamo saying, or maybe spiritual attack. Then in Hausa, it's called Bugunjini.
Bugunjini.
Oh. And in Yoruba, it's also called Ota, Ofa.
Ota,
as if there's a fire on you or something spiritual. I mean, that's
why is it likened to spiritual?
Well, it's a misconception. But I think the Yorubas have gone further to actually call it roparose. Okay, that means paralysis of the arm as well as the lower limb as well. And they quickly made the distinction between that and poliomyelitis because there's always a mix-up. Poliomyelitis, they will say romolakpa, romolese, because that's for children.
Romolakpa, romolese.
Whereas stroke is rokpa, rose. Okay. I think the distinction there is because for polio, you avoid injections, but not in stroke. For stroke, you need to give injection. So that misconception must be clear. If you have stroke, of course, you take injection for you to get treated.
I see.
Now going to the question on what is stroke. Basically, the key problem in stroke is there's no blood flow to the brain, either because of occlusion of the vessel, the pipe carrying blood to the brain, or there's actually a rupture of the pipe. So we could just liken the scenario to a plumber, who wants water to flow at the tap. Two things could happen. Either there's a blockage before the tap, or the pipe has actually ruptured. So that would take us to two basic types of stroke. One in which we call it dry stroke.
Dry
stroke, I mean when the pipe is blocked. And then a wet stroke when there's a rupture or a burst of the pipe. So the one in which the pipe is blocked is called cerebral infarction. The one in which the pipe has actually ruptured is called hemorrhage. So it now depends on where the hemorrhage is, whether it's into the covering of the brain, which you call subarachnoid hemorrhage, or if it's into the substance of the brain itself, then you call it intracerebral hemorrhage.
I see.
So those are the key types of stroke.
So what could lead to a situation where part of the arteries or veins taking blood to the brain is either blocked or ruptured? What could lead to that?
Yeah, a lot of factors are actually responsible for stroke. And the predisposing factor to either one, they're all same, more or less, except that there's some additional ones when it comes to hemorrhage, the one in which the pipe ruptures. But the leading cause in almost 80% of cases is hypertension, high blood pressure. High blood pressure damages 4 organs in the body: the brain, the heart, the kidney, and the eyes. So when the blood pressure is very high, it damages the vessel wall. It leads to what we call lipoalinosis. It makes the arterial wall, okay, to be rather thick. And then eventually they could now develop some tiny aneurysms, which we also call charcoal butchered aneurysms, okay? And those aneurysms, they're like small dilatations. They could get blocked readily, the very tiny ones, or they could rupture. So that is the way that leads to it. Of course, there are other factors as well, including if you have diabetes mellitus, which of course we have an increasing epidemic proportion of all this condition in the country. And if, of course, if you are very obese, okay, is also a predisposing factor. When you have very high cholesterol, high fats within your blood, high cholesterol and the like will also lead to it. Then in addition, smoking, alcohol abuse, and then exposure to air pollution as well. So even when you inhale fumes and lead, waste, and all what have you, they're all predisposing factors. Age, of course, is a standalone risk factor.
Yeah, I was going to ask. About the issue of age.
Age alone is a standalone risk factor.
Okay.
Of course, there are other comorbidities, particularly the black skin as well. Stroke, of course, is commoner in the black skin. The black skin, there's enhanced genetic predisposition. We're predisposed to stroke. Yeah, and being a male. Well, there's what we call the epidemiologic transition, which had actually contributed to the increasing epidemic of stroke. One, because people are now living longer, the population is growing, and then there's unchecked rapid urbanization or industrialization, and the lifestyle modifications, which we have not kept to. People not doing exercise, not taking healthy diet as well. We encourage diets that will be rich in fish, vegetables, fruits, and all what have you. And then, of course, avoid most of those fast food joints, which often they're very sugary, they're salty,
but I wonder,
they're fat,
Professor, you're going to somewhere, someone is going, what is Professor saying? But of course, you're saying what should be, but you see, in our towns and our places now, you see fast food joints opening up, new branches on daily basis, and everybody say, yeah, we have a new one just by the corner, and so on. And some of the adverts are so attractive, some of the things, the pictures and videos and all of that from them are so attractive. How can one discipline himself from all of those? If you turn right and turn left, if you turn right and turn left, back and forth, just around you, you have fast food outlets everywhere.
Yeah, absolutely. You're right. Once you restrict the temptation as much as possible, even when you're in a community where you have a lot of fast food joints, in some studies done, people in that environment, they're 13% higher risk of stroke compared to people who do not even have fast food joints around them. That is not to say that we shouldn't, but it should be minimized. And of course, you should eat healthily. More greens, more vegetables, and then, of course, less salt, very, very important. Less sugary items, less fried items as well. But one of the ways to actually discourage that is to put higher taxes on items that are very salty and sugary. You could have this simple bread, this is 10 naira, and the one with high sugar and high salt, make it 100 naira. For that will attract more tax.
And of course, that will discourage.
From government, exactly.
All right. So on a day like this, how do we commemorate World Stroke Day?
Well, the first thing to actually say is the fact that we're emphasizing on prevention at all costs. Okay, and particularly because, in fact, we're talking of population-wide prevention strategies, because on a daily basis, stroke has been on the increase, particularly in the black community. In fact, it's reminiscent of the biblical 666, the book of Revelation, chapter 13, verse 18.
Wow.
We cannot but to talk about that. And that 6 is very, very peculiar to stroke. If you spell stroke, how many letters you have in there? There's 6.
Okay.
2012, we're saying 1 out of 6 individuals in a lifetime will come down with stroke. So that we have changed to 1 out of 4 now. So by the time you walk on the highway and you meet 4 people, 1 out of those 4 will come down with stroke.
Wow. That's scary.
Is an epidemic proportion, and that's why we're emphasizing prevention. Every 6 seconds, someone is developing stroke somewhere in the world. Every 6 seconds, someone is dying of stroke somewhere in the world. On a yearly basis, 6 million people will die from stroke. Whatever you do,
6
1
million?
out of 3, yes. 6 million people will survive, 6 million people will become disabled. So it's 1 out of 3, okay? And if peradventure you develop stroke, stroke is not curable, but treatable. There's a difference between curable and treatable. And we also need to know that there are a lot of conditions that are treatable, not curable. Take hypertension, for instance. Take diabetes, amongst others. They're all treatable, but not curable.
So what's the difference between the treatable and
take malaria, for
incurable?
instance. Take typhoid, take TB. Can get you cured and then you stop your medications. Okay? But for these other ones, you need to continuously be on your medication. That's why the word is treatable. So if you develop stroke, it's not malaria that will go in 3 days. It takes 6 weeks to 6 months, again, for optimal recovery. And also, we could stretch this 6 further. I mean, there are a lot of, so everything about stroke relates to about 6. But now we say 1 out of 4. So the bottom line is to prevent. In terms of prevention, there are about 5 degrees of prevention. There's the primordial, which is the general prevention strategies, which is applicable to stroke and even communicable diseases like infections and the like. So you need to, of course, take all this good food we're talking of, a lot of vegetables, a lot of fruits, a lot of grain, fish, and what have you, and avoid smoking, avoid alcohol, do your daily exercises. 20-30 minutes exercise almost on a daily basis or every other day is quite in place. Even if you cannot do all the jogging, you can keep dancing. Just keep doing something.
Yeah, that makes it really simple.
Yeah, and then
just
of
play
course,
your music and do your
and do all those stuff.
do all those. Nice.
Yeah, that makes a lot of difference. So that's primordial prevention. And then of course avoid all those sugary, salty food. Then primary prevention. If you have diabetes, for instance, hypertensive, you have high cholesterol, you must treat all these conditions. Then you live a healthy life. Okay, if you treat hypertension alone, you can reduce the stroke risk by up to 40%. Okay, and then therefore secondary prevention, you have had a stroke, and then you want to prevent a reoccurrence, because once you've had one, there's the tendency to have another one. So really? So you take medications like aspirin, clopidogrel, or any of those statins. Those statins, we also use them to bring down cholesterol level, but they have a lot of other benefits as well. So that takes care of secondary. Then for tertiary prevention, patient has had a stroke, and then you want to reduce the mortality or the morbidity. You want to reduce disability of the patient, and you want to reduce death. If you present early enough in the stroke unit, in our center, in the Lagos State University Teaching Hospital, we have a stroke unit there. If you present early enough, we improve the outcome. So that's like a tertiary. Quaternary, maybe that's for your choice of medication, which we don't need to go into that extent.
When you started earlier, you said that you likened it to a plumbing, mechanism where either the pipe is blocked somewhere or is ruptured.
It's ruptured, yes.
So if we are able to identify an artery or a vein that is either blocked or ruptured,
absolutely.
Is it how challenging would it be to either clean up the blocked or the clogged artery or vein, or mending where it is ruptured?
Very brilliant question. And that takes me to what we simplify by saying the 3 P's when it comes to stroke. The first P relates to the passenger. The second P relates to the pipe. That's the passage. Then the third P relates to the power. That's the brain. So if one looks at those 3, then the approach to managing them becomes simple. So let's take the passenger. That has to do with the blood flow. So if the blood is very thick, either because of high cholesterol or sugar or whatever, then it becomes viscous, it doesn't flow freely. And that informs why you use things like aspirin or clopidogrel. And if a patient presents early enough, within the first 9 hours, you can actually give some clot busters. There are things we call clot busters, They will break down the clot, and then the blood flow will improve, Then you could also still go further and do what they use, a clot retriever, which we call endovascular thrombectomy. Just like the pipe is blocked, and then the plumber gets there, we use this plunger to bring it out.
Sucking it out.
Exactly. So in the vascular thrombectomy, so that's another way to do it. Then if you now look at the passage itself, two things you can also do. When you give you see when the pipe is damaged, they develop what we call atherosclerosis. It gets thickened. When you give all this cholesterol lowering agent, those statins, they actually work on the passage as well. And there's also something, you also may need to do what they do called carotid Doppler, to check the patency of those pipes. And there are instances they do what they call carotid endarterectomy. Those plaques inside, they can trim them off, so that at least you ensure the blood is flowing. And now the last P, that's the power, that's the brain itself. It used to be old school that the brain cells do not regenerate. That's what we were taught in the medical school many decades ago. But now we know that even in adult brain, there's some neuroprogenitor stem cells. So you've heard of stem cells before?
Yes, of course.
Stem cells are like mother cells. They can bear any type of child you want them to. So if you give some agents, they will stimulate those stem cells. They will migrate to the site of injury. And they start a rewiring process. They start laying new cables, what we call rewiring process or neuroplasticity. And medications like Neurohid and citicoline, they assist towards this. So that's the approach towards.
So theoretically, if those 3 Ps are considered, and they can be worked on, the person can come back to normal.
But the blunt truth, 1 out of 3 will survive. I mean, 1 out of 3 will have significant disability, and 1 out of 3 will live whatever you do. But a lot of factors. In fact, when we talk about complications of stroke, again, we can remember that by saying just the 8 Ds. D in about 8 places. Most words that start with D, they're usually not very pleasant. D could be for death. Could be for disability. Could be for depression. Could be for deep vein thrombosis. They could develop clots in the limb. It also could be because they develop decubitus ulcer as well. Then they could have dysphagia. They cannot swallow. They could have dysphasia. They cannot express themselves, and they could get dehydrated because they're not taking fluid. So all those Ds can set in as complications.
But that would require surgery, isn't it? Very complicated surgery, is it?
Well, in some cases, they need to go in and evacuate and do what we call minimal invasive surgery. But those facilities, they have very limited centers.
So in the nutshell, prevention is just the best way.
Prevention is the key.
And
absolutely.
We have to watch our daily habits,
exactly.
what we eat,
exactly.
What we smoke, if at all there's anything like that. No smoking at all.
No
and what we drink.
Abuse,
and then also exposure to some other environmental issues that could make us, and then importantly, exercise.
Exercise, absolutely. Absolutely.
Professor Yomi Ogun, thank you so much for the lecture process. In fact, it makes me feel like I am a medical student now in your class.
Interesting.
Thank you so much for coming.
Thank you
and thank you for this enlightenment as well.
My
and
pleasure.
On a day like this, we hope that the people will begin to imbibe some of the tips that you have given so they can prevent stroke. Thank you.
Thank you so much.
Thank you very much.
Nice
thank you.
you.
Right.